Wisdom teeth, as they're commonly called, are also known as the third molar teeth. These are teeth that typically come in your later teen years, and unfortunately, a lot of times they come in a crooked orientation. If the teeth come in straight, we don't always take wisdom teeth out. The reason for taking them out is because they're coming in at an abnormal angulation and causing problems with your oral hygiene. The most common reason for removal of wisdom teeth is inadequate space. If there's inadequate space, a lot of times the tooth will come in partially and it will not be in enough for you to keep it clean with your toothbrush. By getting these teeth out early, you can eliminate hygiene issues and therefore protect your other teeth. When you come in for a wisdom tooth consultation, oftentimes this is the patient's first surgical experience because these are typically performed in younger patients. We always encourage the family to come along for the consultation appointment, at which time we will obtain x-rays, do a thorough examination, and then discuss the x-rays and what we're seeing in our exam. If the wisdom teeth require removal, we will discuss anesthesia options. We typically provide IV general anesthesia for the patient's comfort, and then a surgical date is selected. Prior to the surgery, you will not have anything to eat or drink for at least 6 hours and need someone to accompany you home to drive you because you will be too sleepy after the surgery. Once you are asleep with the IV medication, we numb up your mouth with numbing medicine, then we begin the procedure. The teeth are typically removed surgically, meaning they're cut out, and dissolvable sutures are put in afterwards. Once this is completed, we awaken the patient and your mouth is still numb at that point. This gives you plenty of time to go home with your ride driving you home and start taking pain medicine before the pain becomes unbearable. When a person's wisdom teeth are removed, they typically have swelling which will increase the first 48 hours. Once it peaks, the swelling goes away rather quickly. During the first couple of days, patients oftentimes will need pain medication, but after that, over-the-counter medication typically works well for most patients. The best way to find out if you're a candidate for wisdom tooth removal is to schedule a consultation. At that appointment, we will obtain x-rays and do an examination and see if this is a procedure which is necessary for your specific case.